Hello and welcome to Jam. My name is Shankar and today we are going to learn some basic terminology of US healthcare. So this is our basic US healthcare and what we're going to understand some of the basic terminology of US healthcare. So let's start today's topic. So first we're going to understand the terminology which are related to policy. That is something which is related to insurance policy. So here we're going to take a look at the four terminology. The number one is subscriber, insurer, insured, and beneficiary. Subscriber is a person which is very easy to understand. The someone who makes payment. That is in terms of policy. The subscriber is someone who pays premium to the insurance company. So subscriber can be a person who buys himself or herself insurance, or it can be an organization who purchases insurance for their employees. The next is insurer. Insurer is the person who provides insurance. So that means insurance companies are going to be the insurer. Then the third is insured. Insured is the person under whose name the policy has been written. Again, I repeat, insured is the person under whose name the policy is written. Insured can be a subscriber and cannot be a subscriber. Not necessarily will have to be a subscriber. For an example, if your organization pay for your insurance policy, then they are the subscriber, but insured are the person under whose name the policy is written. Fourth is beneficiary. Beneficiary is someone who takes benefit of the policy. So if someone has purchased a healthcare policy, anyone who comes under that policy and takes benefit of the policy will be considered as beneficiary. So that include the insured person, also the dependent. So dependent, let's say somebody has purchased the policy, the spouse and children will become dependent. So when they take benefit of the policy, they become beneficiary. When insured, the person under whose name the policy is written, that person take benefit, that person become beneficiary. Let's move to another terminology. Okay, now we're going to learn healthcare terminology related to out-of-pocket expense. So when you purchase a healthcare policy, it is not like that everything will be paid by insurance. There is something that patient needs to pay out of the pocket. And there are three types of out-of-pocket expenses which patient needs to make. And they are copay, co-insurance, and deductible. Let's take a look at copay. Copay is defined as a fixed dollar amount that needs to be paid at the time of visit. Well, that dollar amount depends on the type of visit you're going to make. If the patient goes to a primary care physician, then this amount will be lower. For an example, it may be between $10 to $25. And when the same patient goes to see a specialist, someone who's a specialist like cardiologist or a skin specialist and a surgeon, then it goes up to between $35 to $50. It may be more than that depending on the plan you have subscribed. And for inpatient admission, it can be higher than that as well. It can go up to $100 more than that. Next is co-insurance. Co-insurance is something that is a responsibility of the patient. So when you purchase an insurance plan, the policies are sold by the coverage which offers on a percentage basis. That means nothing will be 100% covered. So you can buy plan which offer coverage like 90%, 80%, 70%, 60%. So there is a possibility that you went to take a procedure and underwent any procedure and the bill was submitted to insurance company. Then if your policy is, for example, 70% coverage policy, then 70% will be paid by the insurance company and then 30% will become your responsibility. This is known as co-insurance. So co-insurance is the percentage of the responsibility that goes from the patient. So if patient has purchased any other plan apart from that policy, that will be transferred to the other insurance. Otherwise, they have to pay from out of pocket. Next is a very important terminology, which is deductible. Deductible is something which needs to be paid by patient itself, and that's an annual amount. Whenever the policy is being purchased, uh, the insurance policy put an annual deductible amount, which is fixed annual deductible amount that needs to be met by patient through medical expenditure. For an example, if your annual deductible is for $180 for the whole year, then for first few medical expenditure till the time this $180 is not met, insurance company will not make any payment. That $180 has to be met by patient. Suppose a patient goes to a doctor and there was a bill for $200. The insurance company will consider only $180 as a deductible, and then only $20 will be considered as a payment qualifier. So once this $180 deductible has been met, only then insurance company will start making payment. And remember one thing about deductible. Deductible is something which needs to be met through medical expenditure. It is not something that you can pay upfront. That patient don't get this opportunity that they can say, okay, take $180 well in advance and start my coverage from the day one. So deductible is something that will be met through the medical expenditure. Once medical bill will be presented to the insurance company will evaluate it and they will apply deductible accordingly. Once that deductible has been met, then they will start making payment for your healthcare bills. So that is all for today. Thank you for joining. Thank you for your time and stay safe, stay alert. Here is the Shankar signing off. Thank you for your time. See you next time.